Hello, everyone. My name is Heather Hughes. I'm a licensed master's social worker, and I'm the older adult behavioral health PASSAR specialist.
And my name is Mia Rigsby, and I am also a licensed master social worker. And I too am an older adult behavioral health PASSAR specialist.
We wanted to take the time today to talk about social isolation and resiliency. So what's the purpose of this training? So during this training, we're going to teach you what is social isolation and how to be resilient during these times. So the big elephant in the room is that last year, COVID-19 impacted us all. And it goes without saying that because of COVID-19, there were some consequences that happened, not only health-wise, but also mental health-wise. So we know that a lot of individuals became socially isolated from one another during these times. We were told that we had a shelter in place. We couldn't go to the places that we once frequented. We could no longer go to the mall or the senior centers. Even going to the doctor's office was an ordeal, if you remember. We had to get pre-screened, we had to get temperature checked, we had to let them know if we were not feeling well. Sometimes doctors requested that we be tested before we show up in their office. It was quite extensive and quite of a dramatic change last year. What happened was many individuals became isolated, meaning that they were cut off from these different programs and different services. And unfortunately, sometimes individuals begin to experience depression symptoms. Now, we're going to go later in this presentation and talk about depression symptoms. So I'm not going to get into that too much here, but I do want to kind of talk about some of the health effects that depression can cause. If you're already living with high blood pressure, we do know that depression can actually intensify that high blood pressure. We also know that there is a correlation with heart disease and depression. I do not want to get technical in this presentation about it, but there is a very strong correlation. Also, obesity can be affected. Because if you're just sitting at home all day, maybe not getting that exercise in, again, you're feeling isolated from everyone, you're feeling that really there's nothing you can do because, again, you're isolated and all you're doing is watching TV and not being super active. We know that obesity can occur. We also know that it can weaken the immune system, right? Because depression in and out of itself is that feeling of sadness, right? And what is our immune system? We are a big bag of chemicals, as I like to call it, right? So if we're not feeling our best physically, that's going to impact us as well as mentally. So it can actually weaken the immune system and cause us to get sicker, believe it or not. And also we know because of COVID-19, anxiety became ever present, right? Because everyone was afraid of the health consequences. What if I contract COVID-19? Am I going to have to be at home and can stay in my house? Am I going to have to go to the hospital? Am I going to have breathing difficulties, right? There were a lot of health consequences and still are of COVID-19. So anxiety is normal with that. And then obviously the big elephant in the room is misinformation from media sources, right? This was a ever-changing and still ever-changing pandemic. So there was a lot of information that was going out from multiple different sources. And I'm not sure if you felt like this, but I had a very hard time trying to decide what information that I was supposed to listen to and not listen to. That increased my anxiety level. And what I want you to understand is depression and anxiety are common. They are so common. And if we can start talking more about depression and anxiety, I think this will help also with the social isolation. Because the more that we talk about how we're feeling and how we are doing, that may motivate other people to open up and talk. You may realize that the person next to you is actually dealing with the same things you are, and we're actually not as different as we think we are. So what is social isolation? We kind of spoken about it, but we haven't really defined what it is. So social isolation is a state of complete or near complete lack of contact between an individual and society. So again, with COVID-19, for, I think it was like 5-6 months roughly, everything was shut down other than grocery stores, doctors' offices, and hospitals. Really, we were completely isolated. We no longer could go to that senior center. That would be socially isolating. But it differs from loneliness, because loneliness is reflecting a temporary and involuntary lack of contact with other humans in the world. So what I really want you to understand is loneliness is temporary, right? It's usually temporary is what I should say. And it's involuntary, meaning that we really have kind of no control over it. Where social isolation is, we've had just a lack of contact between society and other events. So they're a little bit different. Social isolation is longer term, is really what I'm trying to get a point, where loneliness is very temporary. So when we're talking about an older adult, I always love to use the iceberg analogy. So I'm sure many of us have heard the iceberg analogy, actually. So I wanted to make this infographic right here. So as we see on top of this picture, we have the adult or the older adult, right? That's going to be the physical aspects you can see. They have brown hair, blue eyes, they wear glasses, they have a limp, whatever it may be. That's the physical attributes that we can see. But what we don't see a lot of the times is this big underlying thing, this iceberg, right? There's a much bigger portion of that individual other than what you just see physically. So I'm not going to go into all of these. I just want to point your attention to a couple of them. Social isolation, as we've been talking about through this presentation, that definitely affects an older adult, right? If you're cut off again from the world, from your friends, from your loved ones, from extended family, that is going to have a direct impact with your ability to be resilient. We're going to talk about that a little bit later. Again, we already spoke about depression. I don't want to get into that too much, but we also know that there are some behavioral health concerns or mental health concerns, right? As I spoke about, depression and anxiety, they can be exacerbated. They can also have an onset during this time, right? Is that maybe you've not been diagnosed with depression and or anxiety in your life. And because of COVID-19 and that isolation you felt, maybe you have been diagnosed with anxiety. Depression and anxiety are two of the most manageable mental health diagnoses, and they're the most common mental health diagnosis. So what I really want you to understand is just because you're seeing something physically on the outside doesn't mean that underlying or underneath that individual is there's not all these things going on. So we can't just look at someone and say, oh, I don't think they're depressed at all. Right? Because what we do know is that sometimes people can put on a smile, they can get on the phone, they can talk, and you may not know anything is going on. But inside they're having feelings of worthlessness and hopelessness. So just be aware of that. And as I've been talking about the mental health, I do just want to direct your attention to this as well. We know there's a rapidly growing geriatric population starting in 2011 and ending in 2030. 10,000 adults are going to turn 65 daily. And by 2030, older adults will account for 18% of the world's population, right? So we're having a rapidly growing geriatric population. So that goes without saying, because older adults population is growing, we're also going to have older adults who are aging that are living with a serious mental illness. Nearly 1 in 25 or 10 million adults live with a serious mental illness. And people over the age of 55, 25% of those individuals suffer from a mental disorder. So we want to be aware and we want to destigmatize. We want to bring mental health into the forefocus. We want to be able to talk about depression and anxiety and a whole host of other mental illnesses. So we can start having these conversations and we can realize that just because someone is living with a mental health disorder, it's not a scary thing, that they need to be accepted, and we need to start having these very real conversations. I'm going to turn it over now to Mia Rigsby so she can talk about the second half of this presentation.
Good afternoon again. So, some warning signs of depression that we should be aware of in our older adults. One is a loss of interest in things that are usually found enjoyable. So sometimes our older adults, they may like to go play bingo or like to go bowling or even like to go and sit at the local fast food restaurant and enjoy time with their friends. But they're not doing that anymore. That could be a sign of depression. Maybe they're cutting back from their social interaction. Their self-care is not as it used to be. Their grooming is not as it used to be. You notice they have a beard now, or they're not going to get their hair done, or they're not putting on their makeup. That could be a sign of depression. They may be breaking their medical regimens. They may go to the doctor every 3 months, or they may need some type of a test or exam done, and they're not doing these things. That could be a sign of depression. Experiencing a significant personal loss, such as a spouse or a family member or a close friend, that could lead to signs of depression and feeling hopeless or worthless or as if they're a burden to their family. They may start to feel some signs of depression. And we want to be aware of these signs. Also, suicidal intent. It may surprise you that our older adults, they are the most population who actually complete a suicide, a suicidal act. And that's because they have access to their means of suicide. That means they are serious about not wanting to be a burden to their family. They also understand that most of their life is behind them. So they are serious about suicidal intent. These may be signs of depression that we should be worried about, and we should take into great consideration when we're talking to our older adults. And if someone you know needs help, please be aware of the resources in your community. Here in Anne Arundel County, we have a Warmline that you can call any time of the day, any time of the week. It can be Christmas morning and you have a loved one who is experiencing some signs and symptoms of depression or some suicidal ideation. We want you to call. It could be New Year's Day at 3 in the morning. Call Anne Arundel County's Warmline. There is also a national suicide prevention hotline that is listed here that you see. Please call this line as well if you are not in Anne Arundel County. Also, there is a 211 that is a statewide phone number that you can call to get in contact with someone in the mental health realm to help you deal with your mental health issues. And don't be afraid to speak up. Be there for your older adult. Help them get connected to the professional help that they may need. There are tons of resources out here, but we have to know where to find them. And 211 is a great help for that information. So we want to talk about resiliency. So you've been dealing with some depression. Your older adult has been dealing with some anxiety. Resiliency is defined as bouncing back during a hard time. You've just been going through some things and you're just tired and you're burnt out and you're worn out. Well, guess what? You can bounce back. Some examples of how to bounce back could be an appreciation of moments in time. Take a second and look in the sky. Look at the trees, look at the birds, look at the flowers. Just take a moment and be mindful of what's going on around you. Viewing yourself as young at heart and in spirit. You may feel a little old, your knees may be hurting, or your older one, their back may be hurting, or they are suffering with arthritis, or just they don't want to go out anymore, but they still feel young at heart. These are some things that they can do, turn on the music and dance a little bit. I always believe that music conquers a lot of things. It can connect people from different cultures, people from different ages, different sects, different religions. Being able to laugh and to have a peace of mind. Maybe go to a comedy show or turn on something that will make you laugh and ease some of your thoughts and your anxiety and depression. And basically just accepting things that cannot be changed, including aging. I like to think of life as, in life we have seasons. We have winter, we have spring, we have summer, and we have fall. And in our personal lives, I believe that is true as well. In the winter time, we just, in our mind or our financial situations, we just may be feeling some type of way where nothing is going right. And we're just totally tired and depressed and we don't feel like doing anything. But we know that spring is coming. This is a time for resiliency in our life. Things may be starting to look up. Things may be, our seeds have been planted and we're looking forward to the growth of these seeds. Just be grateful and be mindful. And then we have summer where everything is going right. We're at peace, we're happy, we're living our best lives and things are just grand. And then we have fall where we know sometimes we start to feel a little bit sad because we know that the cold is coming back. So there are seasons in life and we must accept these seasons and just learn how to cope and how to deal with these changing seasons in our older adult lives. Also, some resiliency examples could be stay in contact with your support system. For our older adults, they may need friends, family, doctors. They may have social workers or someone who brings them meals. It's important for them to interact. It's important for them to get out and to maintain a system so that they won't fall deep into depression. Also, it's important for someone to call them regularly to help to ease the anxiety and the loneliness. It's important for not only our older adults, but for everyone. Sometimes turn off the news. Sometimes it's nothing on there but just depressing news. This happened, that happened. It can take an emotional toll on our older adults. I'm not that old now, and I know it takes a personal toll on me to hear all the disturbing and and issues that happen on the news. Go for a walk. Take a deep breath, count to 10. Maybe do some exercising, a couple sit-ups, a couple push-ups or something. And I also don't want to underestimate some psychotherapy. Going to talk to a professional, whether it's through telehealth on your computer or actually going into an office. Talk to a professional that can help our older adults deal with social isolation, depression, and anxiety. Sometimes, resiliency can be something as little as getting up and taking a shower or fixing yourself a meal. We want to encourage some self-compassion. Don't be so hard on yourself. Take some time and realize that you've been through some things and we all can't deal with everything that we go through. So it's definitely important to have some compassion for yourself. Believe in yourself. Believe in your abilities. Sometimes we may underestimate what we're doing or what we're going through, but believe in yourself. It can definitely build up your resiliency and help you to be able to deal with life. So I want to bring your attention to a senior check-in line. Now, this is a free, everyone loves free, a free service that will place an automated call to the senior in your life. It will, and if they don't answer after 3 times, This service will call in ultimate or emergency contact to check on the older adult. And so what is needed to sign up is called online aging.maryland.gov, or there's this 1-800 number listed that you can call to get signed up with this free service that will help you and to check on you to make sure that life is okay, to see if you need any help or any resources. And if you do need some resources, don't forget about Heather, who spoke earlier, and myself. We are here to offer resources. We are here if someone needs help finding a resource, please do not hesitate to reach out to us. We are here to help. We try to find those little hidden gems in the community that not everyone knows about. That's what our duty and our role is. So please call us or email us so that we can offer some resources and help. And we thank you. We thank you for your time. We thank you for living your life. We want you to live longer. Get out. Don't be isolated. Interact with your loved ones, with your support system. We appreciate your time. We appreciate you. Thank you so much.
And I just want to echo what Mia said. Thank you again for listening for our presentation. Please reach out. You are not alone. We understand the COVID-19 pandemic impacted a lot of individuals, not only older adults, but professionals, from our friends to our family to extended family. And we understand these are unprecedented times. So please, I cannot stress this enough. You are not alone. We hear you, we see you, and please reach out if yourself or your loved one needs resources. Thank you and have a great day. Bye-bye.